How does thick mucus affect a child with cystic fibrosis? Imagine trying to breathe through a thick, sticky fog that clings to everything. That's what children with cystic fibrosis experience because of the thick mucus their bodies produce. Normally, mucus in the body is thin and watery, helping to keep the airways and organs clean. But in cystic fibrosis, a genetic mutation causes the body to make mucus that is much thicker and stickier. This change impacts many parts of the body, especially the lungs and digestive system. In the lungs, this thick mucus coats the airways and lung surfaces. Instead of allowing air to flow freely, it blocks the small passages where air moves in and out. This makes it hard for children to breathe normally, often causing shortness of breath, wheezing, and a persistent cough. The mucus also traps bacteria and other germs, creating a perfect environment for infections that can become chronic. Over time, these infections cause inflammation and damage to the lung tissue, which can lead to a condition called bronchiectasis. This is when the airways become permanently widened and damaged, making breathing even more difficult. Because of these ongoing problems, lung disease is the main cause of illness and even death in children with cystic fibrosis. The thick mucus doesn't just stay in the lungs. It also blocks the ducts in the pancreas, an organ that helps digest food. When these ducts are blocked, digestive enzymes cannot reach the intestines. Without these enzymes, children have trouble breaking down food and absorbing important nutrients. This can lead to poor growth, weight loss, and malnutrition. Children may also experience constipation and stomach discomfort because their digestion is not working properly. Thick mucus can also affect the sinuses, causing ongoing sinus infections and nasal congestion. Additionally, children with cystic fibrosis often have sweat glands that produce sweat with a very high salt content, which can be a helpful sign for diagnosis. Managing this thick mucus is crucial. Treatments include airway clearance techniques to help loosen and remove mucus from the lungs, medications to reduce inflammation and fight infections, and enzyme supplements to support digestion. Early and consistent medical care can help children breathe better, stay healthier, and grow properly. It's important for families to work closely with healthcare professionals to develop a personalized plan that addresses these challenges. While cystic fibrosis is a complex condition, advances in treatment have improved quality of life and life expectancy for many children affected by it. Always remember, each child's experience can be different, so ongoing medical guidance is essential.